week's time, the McDonough family of Pocahontas watched their normally healthy, active teen Chase get progressively more sick and eventually comatose.
2 years ago today, they didn't think that he would make it through the day, but they credit a great medical team and a whole lot of prayer to get him back to where he is today.
As with almost anything in life, the best offense is a good defense. For Chase McDonough, it's something that's drilled into him every single basketball practice. For his parents,
we have 4 kids. We've seen plenty of things.
That same mantra was the driving force behind keeping their children healthy and feeling well.
Kids had a fever, give them some ibuprofen.
Until what was the norm turned their lives upside down.
I had a lot of guilt for a long time because I've told many people ibuprofen was my go-to.
It all started 2 years ago.
Chase had always been a very active, energetic, go, like a typical teenager.
But for weeks, he was lethargic, just not himself.
It really started very subtly.
For a week straight, Chase was in and out of the clinic, tested for strep throat, mono, and the flu, but with no positive results. By the time Friday rolled around, he developed blisters on his mouth and on his eyes and was hospitalized.
The whites of his eyes, there was no white. They were completely red and blistered.
Meanwhile, his skin had started to blister too. He was reaching fevers of 105 degrees. During an x-ray, doctors discovered he also had pneumonia in one of his lungs, but couldn't explain why his body was reacting in such a way.
Of course, to get his fever down, they were giving him ibuprofen.
It was a move that nearly killed him.
Chase was progressively getting worse at a very quick rate.
By Saturday, the decision was made to transport Chase to Arkansas Children's Hospital, and it's lucky they did.
That's really how we met, unfortunately.
Within minutes of entering ACH, Dr. Jake Lee saw Chase for the first time and immediately diagnosed him with Stevens-Johnson syndrome, what he calls a rare overreaction of the immune system, something that family and doctors had unknowingly been fueling for weeks.
He had pneumonia. His immune system got down, and the ibuprofen triggered it.
Motrin is one of the more common causes, not the most common. I wish I could say there was a way to prevent it, but there's simply not.
There's also no way to cure it. Worst of all, what Chase was presenting outwardly,
it's basically a second-degree burn,
was also happening to his mucosal membrane.
The airway, the mouth, the lips, his tongue, the eyes.
To save his life, Chase was intubated and placed in a chemical coma.
We were being told we're just trying to keep him alive.
Unable to give Chase certain medications, Dr. Lee and the rest of the primary care team had to get creative with treatment.
It's basically they pull a bunch of immunoglobulins from human donors and then they give it to a patient. It actually blocks what the immune system is doing to the body.
Between the immunoglobulins, more commonly known as IVIG, and prayers from people across Region 8, the McDonoughs were simply waiting for Chase to get better. On a daily basis, he was given a 50-50 chance to live until Monday, February 11th, when things took a turn for the worst.
You know, the doctor said, I'm sorry, we're going to do the best we can, but, we give him maybe a 2 to 5% chance to live through the day.
But then something strange started to happen.
They had all done morning rounds and saw how dire the circumstance was.
The new blisters that were forming were just as quickly going away.
So you had to take pictures to prove, am I seeing this right?
Doctors and nurses were being called back to see his progression.
They're coming in really to witness what turned out to be a miracle.
And after weeks of only knowing him as comatose and covered in bandages and blisters, one of the people most happy to see Chase make this comeback was Dr. Lee.
His parents brought him back. It was pretty amazing. And they said, Chase, this is Dr. Lee. This is the man that saved your life. And you'll never forget something like that.
Now, being from Pocahontas, I watched Chase's progress pretty closely, and one of my favorite photos to see was Chase post-coma on the roof of Arkansas Children's Hospital shooting hoops again, but he was still a long way back from being back to normal. During his time in the hospital, he lost 15% of his body weight. But check him out now. He's back to playing basketball and many other sports for the Pocahontas Junior High Redskins, though it did take a lot of hard work and dedication over the past 2 years. You'd have to really look closely to see anything was wrong with Chase. The only lasting difference is due to the scar tissue that's built up in his lungs. He does now have to use an inhaler.
Great story. So My question is, I mean, how rare is this?
You know, I talked to Dr. Lee, and he said that at Children's, they see about 2 to 3 cases a year. But obviously, the McDonoughs so invested in this, they say that they've been watching it. They've heard of more and more cases, and that's really why they urge parents to educate before you medicate.
Now, he had taken the ibuprofen before this happened. Does that mean he can never take it again?
It really does. It's pretty scary. He can never take ibuprofen or NSAIDs again. He's considered extremely allergic now. If he gets a headache, he can't take Tylenol and things like that. Because this can happen again. He can get it again, and that's the scary part.
Okay. I've got little kids. I'm a parent. There's thousands of parents watching now. We're all thinking, do we have to go get rid of the ibuprofen in our house?
Right. You know, both Dr. Lee and the McDonoughs say you don't need to live in fear. You just need to be aware. If a child would start presenting signs similar to what Chase did, realize that it might be a reaction that they're having, a poor reaction to that medicine.
Incredible stuff. Allison, thank you very much. Back after this.